Greetings friends, today I'll be discussing about the cervical spine X-ray. So when you are suspecting a cervical spine pathology, how do you order for an X-ray? So your X-ray order will be X-ray of the cervical spine, AP and lateral. So what is the particular point that you should be aware of while ordering a lateral X-ray of the cervical spine? So if the lateral X-ray of the cervical spine is done with the shoulder in a shrugged position, the shoulder can come in the way while taking the lateral X-ray. So to avoid that, you can specifically mention in your order that a shoulder pull down view should be done. So what happens is that once the shoulder is pulled down, the neck is quite visible, so that even up to the T1 vertebra it will be visible. So that shoulder pull down view is important while taking a lateral X-ray of the cervical spine. So let us see the normal anatomy of the cervical spine. So the first point is, how do you accept whether this particular exposure is adequate or not? So you start counting from top to bottom. So the first vertebra CE1 is visualized as this. Even the C1 vertebra, even though it doesn't have a spinous process, the posterior arch is quite prominent, and hence you see a posterior arch on your X-ray. So that is C1. The next one is C2, then 3, 4, 5, 6, and the longest process is that of 7. So you should be including T1 vertebra also on your lateral X-ray of the cervical spine. So this particular X-ray is found to be adequate exposure for your assessment of the various pathologies in the cervical spine. So let us go to the other view, that is known as the swimmer's view, which can be taken to identify the cervicothoracic junction. So in this, what do is you ask the patient to lift one hand so that you take the humerus away from the thoracic spine. So you can see the cervicothoracic junction properly. Some people like to do it with both hands up so that both the humerus shadows doesn't come in your way. So this is known as a swimmer's view. Now what all do you look for in any X-ray?